Okay, I think we are ready to get started. And let's see, Carrie, you're going to manage this, I take it. And again, just to remind everyone, I know it's a short time to speak, but as you can see that there's quite a few people who do want to speak. And just remind you again, we welcome written comments that you may wish to offer, as indicated right there on the slide.
It looks like a few folks were not able to join us today, so I'm going to skip down to Anthony Hardy. I do see Anthony on here. You go ahead and unmute yourself, and you're on.
Very good, thank you. Can you hear me?
Yes.
Again.
Perfect, great, thank you. So I'm speaking today on behalf of Veterans for Common Sense, a national nonprofit veterans education and advocacy organization. We are deeply involved in the issues of toxic exposures amongst our military service members and veterans. We've been doing that for nearly 2 decades. And all of our national leaders are veterans who deployed to Southwest Asia during the first year of the statutorily defined Persian Gulf War. I'm joined on today's call by our National Vice Chair and past Executive Director, Paul Sullivan. By way of introduction, I'm again the National Chair and Director of Veterans for Common Sense. I'm also currently the Chair Emeritus of the programmatic panel that steers the Gulf War Illness Research Program within the congressionally directed medical research program in the U.S. Department of Defense. And I'm a former member of the Research Advisory Committee on Gulf War Veterans Illnesses over at VA, and a former member of the Gulf War Steering Committee within VA, and a former leader of the National Gulf War Veteran Organization that existed after the 1991 Gulf War. I'm also myself a Gulf War veteran of the U.S. Army. Dr. Savitz, thank you for your willingness to chair this committee and to take this on, and to all of the members of the committee, appreciate your willingness to take these on. I note that the VA presentation was remarkable for several reasons. First and foremost, to the committee members, you're not starting in a void. Much work has been done reviewing various VA veteran registries, and in particular, a February 2017 NAS report gave a number of many recommendations. Our recommendation to you would be to use that as a starting point and see what VA has done with each NAS recommendation. Second, Dr. Savitz, thank you for your discussion on the end state of the registry. Essentially, how do we know when we're done? I would encourage the committee to keep a veteran or consumer focus. What is the value added by the registry to veterans who sign up to be included after they get that initial clinical exam and any initial referrals that might come of it? Is there any value to veterans after that initial clinical exam? And if so, what is it? We heard mention about research a moment ago, and I mentioned just a moment ago about being the Chair Emeritus of the Gulf War Illness CDMRP, Congressionally Directed Medical Research Program. Our researchers have had, that we funded, and we've now funded approaching $200 million in medical research. Those researchers have had a significant challenge on many occasions in being able to tap into registry data as a source of study subjects. So I'd encourage the committee to take a look at that as well. There was little more than cursory mention of Gulf War troops, as we're in the 30th anniversary of Operation Desert Shield. There was no mention of Kuwaiti oil well fires and the massive levels of microfine particulates coming off of those fires. That's these veterans, including those of us on the call today, are eligible. That's critical as well. There was no mention of chemical warfare agents that troops were exposed to, both in 1991 and 2003 and later in Iraq. And then finally, what does the registry offer for use to veteran participants? We would recommend as well a critical review of DoD's determinations that have direct bearing on who might or might not be eligible for the registry, a review of the disparities in countries of service and eligibility for the registry. And then finally, additionally, there have been multiple legislative efforts, including hearings, roundtables, and legislation introduced to fine-tune the registry or to improve upon it, and to create new registries, including one that's now moving forward about K2. I would encourage the committee to look at those as a source for what is not happening yet that should be. Additionally, outreach to other stakeholder veteran service organizations to invite them to give presentations to this committee on stakeholder recommendations for review of this registry. And in closing, I'd just like to read a quote. Oh, am I done?
You're out of time, but if it's a very brief quote, we'll let you go ahead and finish.
The quote is from a 1997 hearing on Gulf War. And it was, studies of low-level chemical warfare agent exposure were not given high priority because military and intelligence sources had stated U.S. troops had not been exposed to chemical agents. Current body of research proves that low-level exposures cannot cause health effects. Our research program over at DoD has definitively shown that not to be false. And it's unfortunate that one of your panel members gave that quote to Congress and quite frankly should not be serving on any panel related to toxic exposures. We thank you for the time and encourage your work on these issues.
Thank you for your comments. We appreciate that. We'll continue now.
Hello, this is Paul.
Hi, I take it that, again, Carrie is managing this. I didn't hear her, but I see that Paul Sullivan is the next speaker.
Thank you very much, members of the committee. I appreciate the opportunity to make a couple of quick comments. My name is Paul Sullivan, and I am a Gulf War veteran deployed to Southwest Asia from 1990 to 1991. And I helped write many of the laws and then advocated for their passage that created the NAS-IOM process that you are now engaged in. So thank you very much for doing that. I also, while a VA project manager at the Veterans Benefits Administration, set up the data sharing between DoD and VA. I want to let you know that I have a couple of quick thoughts and I'll send some more in writing. The first is that when a veteran goes to VA, the veteran's primary concern is to get better, find out what's wrong, get treatment. However, there's an institutional barrier called the VA claims process, where a veteran must win a disability claim against VA before the veteran receives free care. There are some exceptions, such as pension and the 5 years of free care, another law that I helped push through, where a veteran will get 5 years of free care if that veteran deployed to a war zone. I have a couple of quick points to mention. The first is that the DoD data is incomplete. From the Vietnam War to the Gulf War, I want to let you know, as the person who was the subject matter expert at VA, DoD deliberately withholds some information from VA. DoD further also deliberately, as Anthony Hardy mentioned, withheld information about widespread toxic exposures during the Gulf War. So if this committee or anyone else wants to rely upon DoD exclusive information, you're literally setting the system up for failure. That's why in the VA claim process, a veteran has the ability to write a statement, and VA must believe the veteran's statement about exposures or presence in the location unless there's conflicting evidence from the VA or DoD. So please know that VA requests the data from DoD and that VA needs a subject matter expert on what is deployment, what are the locations, what are the dates, and what are the exposures that will be taken into consideration when requesting the data. And there has to be not a confrontational or adversarial, but there must be a true collaborative approach to make sure that DoD is telling the truth. That's because all you have to do is a quick Google search. DoD has deliberately withheld information on toxic exposures for decades. And if we want to fix this using information and technology, yes, but we have to go in with our eyes wide open. We cannot repeat prior mistakes where DoD withheld information, or for example, where VA withheld the ability to look at animal studies as impacting the health of veterans. We really need to do better if you want to go down this path. So thank you very much. Those are my comments, and I'm really glad that you're looking into this subject.
Thank you. Thank you very much. We'll continue then with the next speaker.
Sure. Rosie Torres, please unmute yourself.
Yes, I'm unmuted. Can you hear me?
Yes, we can.
Okay, whenever you're ready.
Go right ahead.
Okay, yes, first of all, again, I'm Rosie Torres, co-founder and executive director of Burn Pits 360. I just want to thank all of you for your efforts and your hard work. You know, we've been at this since over a decade already. And I feel as if, you know, the conversation we had, the committee had today was along the same lines of the conversation we held when the 2011 report came. So I think our focus should, again, remain on, you know, how would the veteran and the survivor benefit from this? So I'm just going to go ahead and you touch on the importance of what we discussed back in the 2011 report, and that was to somehow convince the VA DoD that it's so important for them to track mortality, right? Like, how can any study be fulfilled in an epidemiology intent without knowing who those are that are dying and what they're actually dying from. So for us here at Burn Pits 360, like, that remains a priority. I understand Eiler was touched on a lot, but I feel like that would just add strength to the data we are already collecting. Maybe stay away from asking so much of those questions on what are people's hobbies and focus more on, again, the veteran and their survivor. So I feel as if, you know, this is a pretty common sense thing. I know Dr. Shuping mentioned John Stewart. The one thing we can do as a veteran community and committee members is to pay attention to what the 9/11 model looked like. We've sat here for over a decade discussing how do we fulfill outreach, how do we make the registry better, but I don't think the 9/11 people, it was that challenging for them. So, you know, let's collaborate with those committees, let's collaborate with those researchers and specialists, and pay attention to how they were able to legislate those rights that those first responders were so entitled to. So again, thank you to the committee, thank you to the staff. You all have been amazing in working with our organization. But I just want to, you know, again, highlight that if we take what the blueprint of the 9/11 community, I don't feel that we would be wasting as much time and tax dollars. I think that working with John Stewart and all of the 9/11 advocates, we can accomplish what that mission is. Thank you so much.
Thank you very much for your comments.
Thank you.
Continue with the next speaker.
It looks like we're missing a few, so we're going to skip down to Lauren Price. Go ahead and unmute yourself and start.
Good afternoon. My thanks from Veteran Warriors and myself personally as a burn pit victim to the Academy, to the staff of the VA who are attending this meeting and participating in this charge meeting, as well as the input that's going to go into the next steps in this task. You have our sincere appreciation. That said, I'm going to just jump into our position is pretty cut and dried. There is a law that was created to create the registry. That law mandated the first National Academy efficacy study, and it mandated this one that you are now charged with doing. It did not mandate that you go out and find everything else that's out there that we, and I say we, meaning the advocates out in the community, like Mr. Hardy, like Mr. Sullivan, like Mrs. Torres. We've all been doing this for over a decade, and we've been asking for this information to be included in every study, in every epidemiological study. And at some point it will be, but your charge is solely to review the registry as it stands at this moment and compare it to where it was when you did this the last time, compare it to the congressional intent contained in the law, and afterward is to take that information and then we're all to get together and decide where it's got to go from there. There's been numerous discussions throughout the meeting today about Eiler, and several of us are part of a coalition that was introduced to Eiler, thank you, Rosie, and has been working with the concept of how we're going to access Eiler and how it's going to be utilized by both VA and DoD and the veteran community at large. It is still in its infancy, and it should not be part of this discussion at this point. It is by no means ready to be even discussed as down the road we may be able to include it or replace the registry with it. The registry, and I reiterate Mr. Hardy's statement, and our position is emphatic about this. This registry contains data going back to the first Gulf War on veterans who have registered. If we take and supplant this with EILR information is containing service members' records going back to 2010. I was already retired at that point. So my records wouldn't be in there, and thousands, hundreds of thousands of other veterans' records would not be in there. It would be a disservice. I believe that if the VA focuses on, and it may be a recommendation that can be reiterated at this point because you included it, the Academy included it in the first round of recommendations in 17, is that the VA seeks outside input and actually utilization of an outside source to help them rebuild the architecture so that the architecture of this registry can be utilized to merge with EILR, to be used by the rating examiners as well as medical researchers and medical providers. That was your recommendation at that point. And we reiterate that that should be, again, and I understand that Dr. Shuping said they're doing it, but we were told it was never going to happen until we see it happen, that it's going to remain a primary recommendation. Thank you for your time. I appreciate it.
Thank you. Thank you for your comments.